I want to just start by clarifying who I'm talking about today, and that is children who have autism spectrum disorder. And what do I mean by that? I mean that those who have difficulties with social interaction and the way they use their communication in a social way, and also have a whole range of restricted, repetitive patterns of behaviour, interests and activities, and also sensory sensitivities. But also, you'll notice from the photographs that I'm using today, these are all of little children. These are children who are 2 and 3 and 4 and a 5-year-old. So I'm talking about preschoolers with autism for the most part and younger. Next slide, please. So this is an important question when we're thinking about children who have ASD, or I'm probably more often going to just say autism, children who've got autism. Do they get anxious as well? Well, in looking at research literature and reading books about autism and ASD, there's quite a lot that has been written and found out about anxiety in these children. But you'll notice if you're reading this literature that it tends to be about older children or those who we used to refer to as having high functioning autism. So children and adolescents who have autism but are also in the normal intellectual range, if you like. And also you can read quite a lot of research about children who have Asperger's disorder. It's a diagnosis which tends not to be used very much anymore, but was always referring to children who were in the normal range intellectually and had a lot of early language. It wasn't delayed or disordered. So when we're thinking about those children and adolescents who have been written about quite a lot, some of the prevalence figures are suggesting that about 1/3 of children who have ASD have problems with their social relating, going to school and being part of family, functioning in a family, that are due to anxiety. So 1/3. So this is a considerable number of children with ASD who are experiencing problems of anxiety. But very importantly, we know that really significant progress can be made for them socially, academically, and with their adaptive functioning, how they're managing on a day-to-day basis, if we can reduce their anxiety. But first of all, of course, we've got to recognise it. Next slide, please. A third of kids with ASD are anxious. Why such high rates of anxiety? Well, we do know that children with autism have problems regulating their emotions. They can go from 0 to 100 really quickly, can't they? And this can make them very reactive in a situation where they feel stressed. So they might be showing really very anxious reaction because they're feeling overwhelmed emotionally and having trouble coping with that. We know that some children with autism can be very upset by any changes in their routine. So that might be another contributor to this high prevalence of anxiety. Changes in expectations. This is what I thought was going to happen and it hasn't. And now I'm feeling anxious and worried about it. There are other children with autism who are just apprehensive in social situations generally. When there are more than just the familiar people around them, they get worried and fearful and socially anxious. There are children with autism who really get worried about future change. They know that change is about to happen, but get very worried about it. I've heard lots of mums say, well, I know I've got to tell him that something's going to be different, but I do it one day before. Do I do it a week before? Do I wait until 10 minutes before? Because I know that he's going to be really worried. How do I work out the timing of that? And there are other kids with autism who become anxious because they have trouble understanding what's going on around them. They have trouble reading the room, if you like, really understanding the social interactions that are going on around them, and maybe not even just the social interactions, just where am I, what's going on. Now, I'm not making a lot out of this last point, and it's a dot on the bottom, which is smaller, but there is literature that suggests that anxiety can run in families. So a child with autism might be anxious because that's something that's in the background of that family. One or both parents might have experienced anxiety in their childhoods, or it might even be in grandparents. So there does seem to be an increased rate of mood disorders in parents of children with autism. And that research has been going back probably 20 years now. Next slide, please. So we come to an important question, I think, to answer, and that is, do young children with ASD get anxious? And yes, they do. We know that some very young children with autism can be anxious, and anxious to the extent where it's really interfering with their day-to-day activities, with their enjoyment, with their ability to play and learn and be part of the family. And I think this is really important, and I think that they're a neglected group when we're thinking about mental health of young children. Next slide, please. So what are the signs that we look for? How do we know when a child is feeling anxious? And I guess this doesn't just apply to very little children. It applies to school-age children, adolescents and so on as well. But we do see these sorts of signs even in preschool, it's young children. So you might see that the child is very distressed and agitated when they're separated from parents or having to leave home. They might be refusing to go to preschool or their school. This is a sign that they're anxious. They might have a pervasive worry, a worry that is just on their minds all the time, and they're feeling fearful and frightened. They may also be just very restless and irritable, hard to get on with. This may be because they're anxious. Timid, shy, withdrawn. These are more obvious signs, aren't they? That if a child is very clingy, hiding behind your knees. I heard one mum describe this as, he's velcroed to my knee. He won't move away from me because he's really very shy and timid. There'll be other children who show that they're anxious because they are very frightened of something, terror of an object. This might be something to like animals, a fear or phobia of dogs, or I've known children who are extremely frightened by small insects, flies, mosquitoes, bees, things like that. There'll be other kids who show their anxiety because it seems to be associated with headache or stomach pains. Or they mightn't be able to tell you that they're actually feeling anxious or talk about their emotions, but they can talk about how they feel. I've got a headache. I've got a pain in my tummy. Other children, their anxiety will be demonstrated through being very restless, having problems with sleep, getting to sleep, staying asleep, or waking early. And there are some children who might also have nightmares. Other kids, anxiety might be showing itself as them having periods when they really are not concentrating very well and are very distracted and distractible. Perhaps they're distracted by these thoughts of things that they're frightened of and worried about. And there are other children who will be reliving a very stressful event, and you can see this because them being involved in very repetitive play. So there might have been an episode, something that's happened to them, which they're very worried and fearful and frightened about, and they will be reliving that event through this repetitive play. Perhaps for something like a child who might have been involved in a car accident. You'll see them repetitively banging cars together or reliving that traumatic event. So these are some of the signs that we can look for if we're wondering whether or not the child might be feeling anxious. Next slide, please. Next slide, please. Thank you. Now, what might cause anxiety in a young child, a preschooler with autism? I think this gets pretty interesting. And an important thing to think about here, I think, is what's their ability to express themselves like? How well are they communicating? Can they really tell us what they want, what they need, what are they feeling? Because if they're having problems with communicating those things, it's highly likely that they'll get anxious and worried. There'll be other preschoolers who really are feeling very worried because they're not coping with change and new situations. We know that preschoolers who've got autism have a high need for predictability. They like things to be the same. They like to know what's going on. We also know that for a child who's at that developmental level, around 3 or 4, they do have trouble understanding social expectations. They're not picking up social rules and things as well as a child who doesn't have autism. So understanding social expectations can be a worry for them. I'm not sure what's going on. I don't know why that little boy did that at kinder or examples like that. They might be fearful in situations because they're actually not understood. So if they're not communicating well, then they can become very upset and worried because people don't seem to know what they're needing, what they want, and what they're trying to say. I've seen a number of little children with autism who'll have a go at saying what they want, and when it doesn't seem to work for them, they just clam up or they walk away. They get worried. There'll be other children who are getting anxious because they're having trouble with processing sensory information. So when there's a lot of sensory information coming in a busy social context, perhaps, if we think about preschool, there'll be a lot going on. There'll be children doing all sorts of things. There are activities everywhere, different noise levels, all sorts of opportunities to be engaged with learning about the world through play, but they have a sensory basis about touch and smell and temperature and so on. And so there are some children with autism who really fear some sources of sensory stimulation. So when we're typically teaching children in a preschool setting, we'll provide them with all sorts of sensory stimulation because it's part of the way children learn about their world. But for some children with autism, that can be quite fearful and frightening. Having to, or an expectation that they will wear certain things or put their hands in certain textures and so on. Next slide, please. So what can we do about this? What can we do about anxiety? And it's important that we do. If we can understand what's causing young children with autism to become anxious, then we should be able to develop some strategies to help them. And I must emphasise that you can't go to the anxiety textbook and find the answer to every problem. It just doesn't work like that. So I think what it does depend on is a few things. First of all, we have to really carefully observe the child, and you have to have a good understanding of their developmental level, their communication ability, and importantly, their profile of autism symptoms. And these are essential. You have to know about the child, how bright they are, what are their strengths and weaknesses, how well are they communicating, do they need some sort of communication aids, and what's happening with those symptoms of autism that I talked about right at the beginning. How is their autism showing itself at the moment? So how well are they managing to communicate socially and interact socially? What's happening? And are there interests, special interests, routines, rituals, other sensory sensitivities, resistance to change? What's happening with those things? Do you know about them? So I think these are the first things that you absolutely have to have thought about, looked at, watched, and talk about with the team who are working with the child. One of the things that I always use and have used for many years is a developmental behaviour checklist, because we can use this to understand what's happening with emotions and behaviours in a child. In fact, we can use this for children who are aged from about 3 right through to 18, 19, 20 years of age. And we did this for a little case study that I want to talk to you about a bit later, because using a DBC can help to define what the problem is and what's going on. Next slide, please. So management might involve quite a few different ways of going about things. So define stressors. Now, you've got to look at what's happening to the child, look at their reactions and responses to things, and see if you can work out what a trigger might be, something that's making them anxious and worried. Because your response might be to modify the environment that they're in. There might be some particular thing in the environment which is making the child anxious. So by modifying the environment, changing things up, you might be able to really have some impact on how anxious that they're feeling in that situation. This next point is something that's been a very important part of my work for the past 25 years or so, and that is looking at how we can teach parents and be thinking about the well-being of parents too, because we do know that when parents are coping better and feeling more confident, then that makes a difference to children as well. So teaching parents, so in a session such as this, learning about anxiety, what the signs are, what to look for, and how to work with others who are working with the child. So that might be teachers or other therapists, speech therapists, occupational therapist, kindergarten teacher, when we're thinking about our little children. It's really very important. Now, modified cognitive behaviour therapy. CBT is something that's used quite often for a range of problems, anxiety, depression, and so on. And we can modify this for little children who've got autism, particularly things like using relaxation exercises for children who've got the language, some simple role play, and some exposure to fear, graded exposure to fears. I don't want to spend a lot of time talking about CBT. That's not the point of this, but that's one of the approaches that if you go to see a psychologist or perhaps a child psychiatrist, they might be suggesting that this is something that you could try. Stress debriefing through little social stories. So if there's been something that's upset a child during the day, you can talk about it. And I do know that some children with autism who mightn't have a lot of language, but they can draw. So they'll draw little pictures of what might have happened to them, and it just gives you an opportunity to talk about that, talk about what's happened in a simple way. Now, the last dot point here is medication, and that is deliberately at the end because it's not the first response. It's something that should be only used as part of a very planned management approach that sits alongside these other ideas, these other approaches. So it's not a standalone and it's not first order. Next slide, please. So there are some steps I think that we've got to go through when we're planning a response to a child who appears to be anxious. Now, in writing this, I was particularly thinking about little children, but I do think that these steps are appropriate for any child with autism or adolescent as well, be they at primary school or at secondary school. So first of all, you've got to think about what the causes are. There has to be really careful assessment about what might be making the child anxious or worried. What could it be? Next, which symptoms of anxiety is the child displaying? Now, in thinking about this, you might find that, and in watching what's going on for the child, that the anxiety seems to be about separating. Might be separating from mum when it's time to go to kinder. Or it might be a particular fear. Is it fear of the unknown? Is it fear of change? Is it a specific phobia or fear about a particular thing? Maybe. Next, look at emotions and behaviours and do a developmental behaviour checklist, and I want to talk about this in a minute. And also think very carefully about what you know about this child and their ASD symptoms, their autism. How is it affecting them? Parents know their children well, and when we talk to parents about what's happening with autism, they're really very good at telling you what's going on. They mightn't understand it all and put it into a whole picture, if you like, but so much useful information comes from parents. I want to give a bit of an example here. So looking at resistance to change, we know that a lot of children with autism are very resistant to change. They don't like changes in their routine. They don't like changes in their environment, but it can be a really good place to start if you notice that a child seems to be anxious and worried. So the first question I usually say to parents or teachers, if I'm working with them, I say, what's changed? What's changed? Let's sit down and think about this. Let's think about it over the past few weeks, because you can help anxiety about change by preparing the child ahead of the change happening. And because children with autism are usually pretty strong visual learners, they learn through their eyes, often better than through their ears. Photographs, picture schedules, simple social stories, or behaviour scripts where you're describing what behaviour you want to see in pictures, photographs or line drawings, or even a specific picture book can show the child about what's going to be happening, and it can help ease their worries. So preparing for change is a really very important one. And sometimes a decision can be made about bringing in a change without thinking too much about it, or you think, well, from a developmental point of view, oh, he's 4, he should be able to manage this. Let's move on and do something a different way, without actually really stopping to think about how we teach that in little steps. So don't impose change without some careful planning. I think too that visual strategies can help with something else as well, and that is anxiety about separation. Pictures tell 1,000 words, don't they? And for children with autism, in my experience, when you show a child photographs about where they are, and if it's worry about separating from mum, where mum is, and then a very clear photograph about her returning to pick him or her up, particularly if it's from childcare or kinder, this can really help. So this is where you are, this is where I am, and I'll be back. And a photo of mum coming back. For children who have a bit more understanding of time, what I've seen work really pretty nicely is an oven timer. So it's clicking back to a 0 point in time, or a clock face. It can be added to that information about when mum will be coming back. So it's putting something concrete in place rather than just saying, oh, later or soon or in an hour. What does that mean if you're 3 and all you're pretty worried because mummy went out the door? So an oven timer that rings, I've seen this used pretty well if you start using it in a fairly short segment first. So mummy drops off and then the time is set and 5 minutes later, mummy's back. Now, this can take some time, can't it, if we're thinking about a 2-hour preschool session or something like that. But this graded change, teaching about mum returning in a very concrete way can be very helpful. And what is happening here is that the child is going to learn that she will be back. The bell will ring and she'll be back. She's coming back. Don't have to worry that she's not coming back. So they're just some examples about how we can work through, it's really a hypothesis. This is what I think the anxiety is about. In the first instance, it's about change. In the second instance, it's about some ideas about managing anxiety that's caused by a separation. Next slide, please. Okay, now I've mentioned the DBC a couple of times, and I want to spend a little bit of time talking about this. So how emotionally and behaviourally disturbed is this little boy or little girl? The developmental behaviour checklist is terrific. It was developed by Professors Stuart Einfeld and Bruce Tong quite some years ago now, and it was designed to help us understand behavioural and emotional problems, to put them into sort of a construct which will become clearer. Now, we do know, and there's been a lot of research on this, that when children and young people have autism, that when we compare them to typically developing young people and those with intellectual disability, they do have more emotional and behavioural problems. And this is why they can present such challenges to us. It's not just the autism, but it's also other things happening as well, which makes the picture more complicated. So we need to understand this to help them. Next slide, please. So there's a parent version and there's a teacher version of this checklist. Parent version, so it's completed by parents, it's got 96 items, and it's asking for information within the past 6 months. And it's really simple to score. You score a 0 for that item if it's not true, as far as you know, 1 for somewhat or sometimes true, and you would circle a 2 if it's very true or often true. Next one. Next slide, please. So this is an example of just part of a page. And so the first item on this is it's asking a question: appears depressed, downcast, or unhappy. So the parent has to think about this. No, that doesn't happen for him. Or there's sometimes, so it's circle 1, or it's circle 2 of, yes, look, this is really very often true. The next one, so this is one that's familiar for most parents who have a child with autism. So it avoids eye contact, won't look you straight in the eye. Next one, aloof, abusive, arranges objects in routine or strict order. And so you go through 96 of these items, which give us a really full picture of what's happening with the child's emotions and behaviour. Next slide, please. And what we get from this is a printout, a graph, and these are wonderful because it's really very helpful to see where the items are sort of pooling, if you like. So on the far left, there's a line, and this is about a total behaviour problem score. Anything over about 46 is letting us know that this is a child who's really got some considerable difficulties with their emotions and behaviour at the moment. There's an area of or a subscale which we call disruptive and antisocial. So this is where you're going to see items such as a child who lashes out at others, perhaps, or hits themselves, kicks others, and so on. Self-absorbed, so the children who are really very self-preoccupied, not too outgoing. Communication disturbance. So this is giving us some idea about what's happening with the way the child is using their language, or more to the point, not using their language very well. And you'll see the next bar is anxiety. And so this is a real case. This was a little boy who was really very anxious. So that's why that bar is the highest one. And next one, social relating. So we can, by looking, by looking at this graph, we can see instantly where most of the items are really coming together. And so for this one, for this child with a high anxiety rating, in fact, it's about 90%. So really a very anxious little boy. The items here that are in red are some of the items that sit on this anxiety subscale. So he was very distressed about being alone. He was excessively distressed if he was separated from a familiar person. 2, very often true, so it's in red. He fears things and situation. He has nightmares and night terrors. His mood's changing for no apparent reason. He appears tense, anxious and worried, and stubborn and disobedient and uncooperative. And if you think back to the slide that was at the beginning of this talk about how anxiety might show itself, these should look pretty familiar to you. So this is all letting us know that this is a little boy who was about 4 years of age, who was really becoming quite overwhelmed with his anxious feelings. Next slide. So one of the things that we really do know, and we know well because we've been working with children with autism for a long time now. In fact, for what it's worth, the first schools for children with autism in Australia actually started back in 1968. And I think that sometimes history gets forgotten, but there's been a whole background, decades now, of people who have been working with, learning more about and helping children with autism and their families. And one thing we do know is that visual systems can really help a child's understanding and reduce their anxiety when they don't know what's going on. They're having trouble understanding things. Next slide, please. I want to talk a little bit about the hierarchy of when we're using things visually. Now, of course, because I'm giving the talk, I can't show, well, in fact, I could have showed, be sitting here holding a real cup. But this is a hierarchy of understanding and the difficulty of it. So a 3-year-old can learn that the yellow cup in their hand that they hold, it's got handles on it. This is my cup. I'm learning cup. I'm learning a word maybe, but I know that this is the thing that I drink out of. If you present a child with a photo of their cup, any cup, it mightn't mean very much to them. So they have to learn that their cup and this photo of a cup are the same thing. One is representing the other. You don't have to carry around a bag of objects with you all the time. That you can have a photo of what you want. Now, the next one is a line drawing. And I hope that you can see that a line drawing or a computer-generated picture like this of a cup is very different to a photo or the real object. And I think this is something that's very important, because when we're trying to teach children to use communication boards and things like this, have we gone carefully through the steps of teaching them about photos and line drawings representing the real object? And I want to demonstrate this in a case study in a minute. Can we have the next slide, please? So an important point, I think, is that visual supports must be appropriate to the child's level understanding, because if they don't understand the visuals that you're putting in place, they can just be very stressful. So any concept that is really abstract in nature, such as time, can be really very challenging for a child who's got autism. And there are times when we use a lot of words, when a few pertinent words paired with a photograph or a gesture, something the child can see, is more effective. And visual systems can definitely help reduce anxiety when the child is unsure about what's going on or what they're supposed to be doing. Now, it's interesting, I'm talking about little kids, but I find that using visuals is also extremely helpful when children are making a transition into primary school or into secondary school. It's just at a different level, but we mustn't forget about how important visual supports are in terms of getting organised and knowing what's going on. I don't know about you, but I definitely need to have a diary, a visual diary, to help keep me on track. I can't keep all of that in my head, and lots of kids with autism, even in the adolescent years, are needing that sort of visual support for extra information. The little picture that's here is to just drive home a point about the differences between photographs of activities and line drawings of activities. So you can see, and this is a really nice thing to do when we want to encourage a child to be talking to us about what happens throughout their day at kindergarten or at school, where you have line drawings of activities, and a teacher or an aide might be filling this in with them. So there's a little tick next to the activities that the child has done. So it really can help parents to find out about what happened during the kinder session. Or another way of doing this is having actual photos of the activities that the child is engaged in. Now, when it's a photograph of the real thing, it's generally easier for the child to understand that rather than a line drawing. I hope that point makes sense, but it's a really, I think, a very important one. Next slide, please. Now, traditional CBT, I mentioned cognitive behaviour therapy before. I don't want to spend a lot of time on it, but there are usually 3 phases in this. And I think that with young children, there are some aspects of this which can be helpful. So phase 1 is about understanding anxiety. So the things that little children can learn, they can start to learn about bodily cues, how they're feeling, how they might have a tummy ache, or they might be feeling butterflies in their tummy, not feeling very well or having a headache, teaching them about recognising facial expressions and so on. That's all possible with careful instruction, very repetitive instruction, and aided by visual information. Now, phase 2, skills training, relaxation, positive self-talk, coaching oneself and self-reward. You might think, well, that'd be much too hard for a preschooler, but we can definitely teach 4 and 5-year-olds some simple relaxation about muscle relaxation, positive self-talk, telling them to tell themselves, I did a good job, I did well, that was good. Those sorts of simple comments. Skills practices in phase 3, where children are gradually attempting to challenge the situations that made them feel anxious, so that they're improving their confidence and skill mastery. More difficult, I think. That's traditional CBT. It's very effective for a number of children who are trying to work through feelings of anxiety. Next slide, please. There's been quite a bit of research, and it's going back 20 odd years now, where clinicians have looked at, do we need to make some changes to typical CBT when we're working with children with autism? And some examples of the changes or adaptations they've made have been to expand emotion education and thought monitoring, so that sort of positive self-talk can be helpful, particularly using visual stimuli, so photographs, line drawings, even role play and films using short videos is helping children to learn better who've got autism. Peer, buddy and play dates, making more of that component can be helpful. And social skills coaching at home, working towards independence and self-help skills, so building up confidence that way. These are some of the adaptations that can be helpful. Now, admittedly, it's more often used for children who are school age or adolescents rather than preschoolers, but I still think it's something that you might keep in mind in a simplified format. Next slide, please. I want to just present to finish up a little case study here. And this is a true one, but from many years ago, and the child is de-identified, but very typical sort of situation. So James, we'll call him, he was 4 with autism, and he had a moderate developmental delay. So he was having difficulty with his learning. He was going to kinder about 3 times a week, and he was pretty happy and settled there. And he had just a few single words. So he was learning to use some schedules and choice boards like the ones I showed you that had photographs. So he could let the teachers and others at the kindergarten know what he wanted to do. And he could show his parents and family what he was doing by pointing to some of the photographs that he had. Now, I was called in because over the period of about 3 weeks, maybe 4 weeks, he'd become really very irritable, and parents filled out a DBC form. So irritability was right up there. He was echolalic, repeating a lot of words and phrases. He was extremely uncooperative at home on kinder mornings, and he became very distressed when he had to separate from mummy at kinder drop-off. So we sat down together, parents, the teacher, myself, and we needed to think about what the causes might be. Something about kinder was making him anxious, was it? Was it busy environment, lots of choices? Was there too much social pressure, like noise? Was he reacting and getting very worried to something like having to wear an apron, a smock? Or was it because of finger paint activities which had been introduced? And lastly, I said to them, well, have there been any changes at home or at kinder? So, next step, the teacher and James's parents made a list of all the things that had changed since he'd become anxious. And they thought that the most important thing was there'd been a change in his communication program. So in the past, this little boy had been using photograph boards of the real objects and activities that he was familiar with to make choices. But it was thought that, look, he was 4, he was going on to 5, let's move him on to some computer-generated symbols instead of the photos. And so he had some new schedule boards, and they were being introduced. James needed to indicate what he wanted to do by just pointing at a symbol of an activity. And he was increasingly teary, he was crying, and even on one occasion he hit a teacher who was approaching him with the with this new schedule board. What did we do? We brought back the old boards of the photographs, not the line drawings. And it was very interesting that within a few days, his behaviour at kinder really settled. He wasn't worried about separating from his mum. His echolalia decreased. Next slide, please. And it was pretty apparent that the cause of his anxiety was that he didn't understand the new schedules and choice boards that he had to use. There hadn't been any preparation for him. There was just a swap over from one day to the next. And he hadn't been taught the steps in the difference between understanding a photograph of a real activity and object or a line drawing. So a month was spent teaching him to match photographs to computer-generated pictures. And over the space of that month, he really learnt that concept that a line drawing was the same as the photo that he'd been used to. So what did we learn? Well, this was a really very important lesson about managing change and the impact that this can have on emotions and behaviour of a young child with autism. That when change happens, it needs to be introduced gradually and with careful teaching. Next slide, please. I want to finish with this slide, and this is just a reminder that when we're looking for a best outcome for child and family, and we think that a child is anxious, there's absolutely no one-size-fits-all answer. There's no lazy solution, if you like. You've got to do the hard yards. You've got to look carefully at what the child's ASD is looking like for them at the moment. Need to consider the child's developmental level, their communication levels. What do they understand? How well are they learning? What's their learning style? Have there been changes in their emotions and behaviour? And only then you really need to work together, I think, and pool the knowledge that you come up with before you can try and find solutions and develop hypotheses. So in this little circle, collaboration, knowledge, understanding, and active inclusion, I think, are the best way to have a good outcome for child and family. And I do think there is a difference between knowledge and understanding. I think that people can have a great deal of knowledge about, for example, autism, but unless you understand that particular child, and unless you put together the knowledge and the understanding, I think you might end up barking up the wrong tree. So all of these things need to come together, and particularly a collaborative approach with those who know the child best, those who are working with the child on a daily basis, putting everyone's heads together.